Good morning, everybody. It's time for us to perform wound dressing. So before that, I'm going to introduce to you my patient. It's supposed to be patient, Mr. Arvin. Say hi.
Hello. Hi.
Then, so today we're going to demonstrate, as what I've said, about wound dressing. We have types of wounds. We have already identified the types during our discussion, and now it's my time to do the demonstration on proper way of dressing. In dressing, you have to gather the necessary equipment first before you have to start. So we have here your OS or gauze, and then we have your betadine betadine, and then we also have your alcohol and as a solution, and you have your picking forceps and your dressing for working or dressing forceps. We have the plaster here, the bandage scissor, and we have your splints. So splints are used in cases of fracture. And of course, we have a vasoreceptacle, the kidney basin, utilized as your vasoreceptacle. Plus, your bandages. Here are your bandages. Okay, in wound dressing, you have to assess first what is the condition of the wound of the patient. If it is bleeding or there are lots of blood coming out from the wound, meaning the object causing the wound was able to cut a blood vessel causing a bleeding. And then, or we're going to assess if the patient is having some injury or fracture as evident by malisod siya o lihok, or the patient will going to complain pain during the procedure, or even slight movement, the patient will now going to shout for pain. Okay, so let's say the patient has fracture. The fractured part is in the upper forearm. And then we have to, since the patient has fracture, so you have to take note that there is an injury. But definitely, in dealing with your and handling patients, the general rule is ABC: airway, breathing, and circulation. First is airway. So the patient was able to talk, so the patient is breathing. And then we have also breathing. So as we have said, talking means breathing. And then we have also your circulation. The last one is circulation. Circulation, so there is a bleeding part on the area. If there is a bleeding part of the area, you have to manage it first before you're going to manage fracture. So let's supposed to be the bleeding part is here. So what will you do is you have to stop the bleeding or minimize the bleeding. So how are you going to stop? You have to get a OS or any piece of cloth, clean cloth, using your picking forceps. If you're going to get your OS, so first is you're going to use the picking forceps, followed by your working forceps. Why? Because you have to remember that this tray here is a sterile tray. So then you have to apply the OS, or if you have a cloth, so you may apply it directly to the wound. And of course, you have to apply pressure like this. So in applying pressure, it helps in stopping your bleeding. You would know if the patients are still bleeding because of the presence of soaked blood in your OS now happens to be soaked with blood. So that's the time for you to add more OS. Add more OS till the bleeding stops. How would you know if the bleeding stops? There is no, or there is light amount of blood present only on the uppermost OS that you have applied for. Or for example, if the patient, even if you applied lots of OS or gauze, the patient's bleeding has failed to stop. So what will you do is you have to elevate the arm like this in cases if there is no fracture. But since we have declared that the patient has fracture, so you have to apply more OS, or the last resort in handling your bleeding, you have to tie or apply tourniquet on the part or the distal part where there is bleeding. Why? You have to apply tourniquet to the part nga nagsamad siya na noon sa samad, just to stop bleeding. But you have to remember that that is the last resort. We need last resort because you have to consider that there are lots of blood vessels that would be deprived from your blood flow or your oxygen if you're going to do the tourniquet. So usually tourniquet application is used for snake bites on those wounds caused by your snakes and spiders and all. Then of course, okay, so you have noticed already that the bleeding has already stopped. If bleeding has already stopped, that's the time for you have to wear your gloves, and after which you have to gather the necessary equipment that you needed during the procedure. But in cases if the wound was caused by an accident, or let's say there is a presence of foreign object on the area, before you're going to apply your OS, you have to wash it first with any form of water. But in the hospital setting, you are going to utilize the NSS solution or the normal saline solution. But in an emergency setting or emergency situation, any water or any fluid form will do in doing the in cleaning the bleeding wounds. Okay, why? Because if there is a foreign object on the wound, of course bleeding will not stop. So how would you do it? You have to pour NSS solution or any form of water on the area before you're going to apply OS. Okay, that's only the condition wherein you have to clean the wound first before you're going to apply pressure. But as you can see, there is no foreign body on the area or foreign object, so that's the time that we are going to apply your OS. So we were going to assume that the bleeding has already stopped. Since the bleeding is already stopped, you have to dress the wound this time. In dressing the wound, you're going to pick up the betadine, then transfer it to your working forceps, and then return and then cover the container. Then apply it directly to the wound area like this. So you have to open first the OS applied, and then apply it directly to the wound like this. Then in circular motion. It should be handled properly so that cleanliness should be always maintained in handling wounds. And why is it that we are using a betadine? Because your betadine solution is an antiseptic solution. And we have already discussed that betadine is used for contaminated wounds. So this wound is considered to be contaminated. Why? Because as we have discussed, contaminated wounds are wounds caused by an object that happens to be unsterile. So this is caused by any sharp objects considered to be unsterile, so it is considered to be contaminated. That is why we are using a betadine. Okay, like that. Then after which, you ask your patient, "Ma'am, you may hold now your gauze." Make sure that the patient will hold it like that. And then after that, you may start offering your plaster. You may assemble your plaster beforehand, or you may assemble it while you are doing the after you are applying your OS. Okay, this is so thin. Okay, like that. Okay, so sorry for the plaster because the plaster is so thin. The application of your plaster or your bandage has reasons. It is one of which is to stop bleeding, and second is to apply pressure, and the third is for aesthetic reason, so that the patient would self-esteem would not be lowered with the presence of the wound, especially if the wound is present on the area exposed to public or people, just like the arm or the worst, your face. So this is now your open type of dressing. Why open? Because there is a opening here. It is not filled with plaster, or you may add additional one plaster, but for this we have to stop with 2 plasters. So that is our open type of dressing, and this is now your closed type of dressing. Your closed type of dressing is usually done for wounds who happens to be sterile, just like for example cesarean section or stab wounds or patients. It is done after operation. Why you're going to use a closed type of dressing after operation? Because those wounds happens to be a sterile wound. That is why also you have to use a alcohol instead of using a betadine. Why? Alcohol does promote dryness in the area. Another thing is, especially if it is intentional wound, it has this tendency to have bleeding. And if you're going to apply betadine, you may misinterpret the presence of betadine as your blood. So better use alcohol for closed type of dressing. But before that, applying dressing, you may apply your antiseptic ointment or solution, such as for example just to counter the presence of microorganism, or to prevent the presence of the normal flora microorganism found in the area to crawl on the open wound that your patient has suffered. Okay, so let's go back to the situation that the patient has already fractured. So in doing so you have to apply your splits. But before that, before application of your splint, you have to assemble first your bandage. This is an example of your bandage. This bandage is a little bit small compared to the normal size of your bandage as discussed by you during your emergency management module. But for the sake of this, the turn demonstration, we have to utilize this small type of bandage for easy and your convenience in presenting the topic, or the topic discussed, your wound dressing. Okay, so these are your 2 bandages. So in applying that, of course, if the patient has fracture, so you have to keep the patient's arm from moving. As you can see, the bandage applied is not even in length. Why? So in having this procedure or any other procedure, you have to develop your what we call as your system, or let's say for the convenience for your convenience and for the convenience of your patient. Okay, so we have to use this small splints just to insert the bandage like that. Okay, then after that you may now apply your splint. Your splint should not be placed inside the tray. Why? Because the tray is said to be contaminated. If you're going to apply the splint, there's a tendency that you are contaminating the tray. Okay. You may ask your patient to hold the tip of the bandage like that, and then that's the time for you to insert the second bandage, your second splint like that. Okay. So first is you have to anchor. You hold this, please. This one. Okay. First is you have to tie the bandage near your client's body. Okay, like that. Insert. And then apply your square knot. Okay, so you known already how to apply the square knot. It should be one over the other, and always over the other. Okay, like that. Remember, the reason of your bandage is for your aesthetic. It has an aesthetic reason. You have to keep it that way, prevent you from okay, one over the other and always over the other, like that. And you have to insert now your bandage to keep it as to maintain its aesthetic reason or purpose. Okay, like that. And of course, you have to check for the to check if your bandage is not too loose or not too tight. You have to feel the arm of the patient like this. If it is cold and clammy, meaning there is poor circulation. And of course, you have to check for capillary refill by pinching the nail bed. So as you can see there, if you're going to pinch the nail bed, the area will become red, and then of course it will become white or pale, lighter, and then it will become pale, meaning it was the area was already deprived with oxygen. You have to check for capillary refill for 5 seconds. 1, 2, 3, 4, 5. So let go. After that, if the patient's area is that already filled with blood, it will remain to be pale. But if it will be filled with blood, so meaning the circulation is good. And then after that, you may now apply your sling to the patient like that, and then then perform or get the vital signs of the patient, and then perform now your checking the condition, the general checking of the condition of the patient. And when you arrive in the hospital setting, and then that's the time for you to remove the dressing. So in the hospital setting, the doctors and nurses will just easily cut your bandage, and after that, apply now your another dressing. Then, so to check for your square knot, you have to pull now your end point, then like this. So the meaning the tying is good and proper. And then after that, you have to remove. So you practice your making of your square knot. And when you're going to undo the changing of your dressing, you have to soak the area with cotton ball soaked with alcohol. Okay, this one, and then transfer it into your working. When you're going to transfer it, make sure that they doesn't kiss with each other, or the forceps doesn't kiss with each other. And then apply now your alcohol, so like this. And you have to remove the first the uppermost plaster like that. Okay. So like this, and then apply now. You may apply now your new dressing, but again, in doing so, you have to wear your gloves. Like that. And then after that, you're going to discard, and then of course you're going to contain the microorganism by folding the soiled bandage like this, and then apply now your other dressing. So that ends our demonstration on application of your dressing. Okay, thank you.